But that's interesting. So I guess we can view sort of USAID's role once again. It's Monica. It's such an education because it's so sophisticated. Is that it's also the idea of really boots on the ground monitoring, like real time and with sort of unfiltered view in well everything's filtered, but with a view of like what is happening that can relay this intelligence back to Washington D.C. or maybe to the federal government. And so I guess I never thought of it as that was part of your mandate or part of your job.
Yeah, exactly. I mean, we were part. I mean, USA was part of the development, the diplomacy, and the defense. They called it the three-legged stool of the U.S. government, and USAID fed into all of those legs. While we focused on the development side, we played a large role in diplomacy. We played a large role in defense, especially when you look at Iraq and Afghanistan and Syria and other countries where we worked, right beside our military colleagues. Um, and I think that, one of the things that we did very well as USAID, again, was having that really in-depth local information, local knowledge, and local understanding on what was happening in each of these countries and what the demographic and the dynamics were. And because of our local partners and our local staff, we were really able to bring a nuanced perspective to the crisis or to the situation, which informed U.S. government policy.
That is a fascinating, Monica. If we should go back to some of the violence that you were witness to, and you talked about the ruling class, like really taking advantage of other demographics within the country. Did you see a theme and a consistency from region to region on sort of um on who was victimized or who these issues were perpetrated on, right? Again and again, or did it vary? Like sort of like what was there some running themes that you encountered or conflict?
Yeah, I think the playbook that these authoritarian regimes and dictators used um, to keep power. I mean, I think that is kind of a playbook, and you see common themes in that approach. But how that plays out on the ground really varies by country because everything, the dynamics in each situation, the drivers, the causes, are really very different, right? So I think you can see common patterns and common tactics used, but what that means really varies. Sometimes even within a country, by in one region versus another. The idea of pitting one group against another is very common approach in political violence. There's always the us and then the them, and driving that wedge and creating that divide among people, making one side almost non-human, right? As if this will, so that it allows people that they're willing to perpetrate really horrific acts against another human being. In Kenya in 2007, 2008 elections, the youth were incited and they were killing other youth, really pitting them against each other. And this was based on ethnic lines. And the violence was very personal. And most of the violence was perpetrated with a panga. And a panga is a very large knife used for cutting grass and farming. And when you think about the images of that, like just imagine thousands of people being killed by panga, by youth gangs in all different parts of the country, over a 1 or 2 day time frame. I think it was a week that all of this happened, and thousands of people were killed.
Ugh.
Um, the what it took to get you there, it took years, right, of intentionally giving misinformation, disinformation that dehumanized another group, an ethnic group, one against the other. Um, and really, this misinformation and gang like approach to recruitment was intentional and it was targeted. And this was the plan of how they were going to maintain control, keep people from voting, and really create this us versus them mentality. After 2009, once kind of things subsided, USAID's project worked really closely with the youth on both sides. Most of them lived in the informal settlements, or the slums. We call them informal settlements. It's a nicer name.
Yeah.
Bringing them together, we brought the youth from both sides together for cohesion dialogues. We brought them together for employment opportunities, knowing that if people are employed, it makes them a little bit more protected from being able to be recruited from things like this. Breaking down those walls and undoing the harm that had already been done. It took years. But in the most recent elections in Kenya, we've had 3 rounds of elections since that really bad violence of 2007, 2008. The violence was almost non existent as youth are really no longer willing to be manipulated by powerful politicians anymore. And they've been educated about what's been happened to them and they've chosen a different path. Will Kenyan elections always be violent free? No. But I do think that USAID played a large part in reducing the violence, and helping to get a new generation of youth that understands what political manipulation is, and have decided that they're not going to participate in violence. So we've really saved lives there, and we've done similar like programming, similar like analysis, and other things in other parts of the world. This is a very kind of common approach for USAID.
You must take a little satisfaction for your good work and for having that violent free election. So, just in case I forget, thank you for doing it. Thank you for your efforts in that. That's remarkable, right?
No, it makes you feel really good, that, the US government, came together. We realized that, that this is something that was important to us, and our values, and we took action and really have made a difference in a lot of people's lives.
One of the things that the Global Health and Relief Initiative is one of our focuses is healthcare, right? We're made of the group is mostly physicians and doctors, mental health experts, and if we go to sort of the mental health part of the equation and the post traumatic stress syndrome, I imagine like you talk about getting these youth together. I imagine that was so vital for a little bit of not only sort of this healing within communities, but also for trying to get the youth, like like, get their minds right, if you will.
Yeah, absolutely, and I think that is something that USAID didn't do enough of, and didn't look at the PTSD, the mental health implications of generations of people, especially children that are growing up in war-like situations,
Yeah.
or growing up, having to deal with this every single day, and what's the impact on them? What's the impact on their outcomes as far as, becoming healthy, members of society, when they obviously, as any of us would, have some mental health implications from this. USA did have a small group of people, and a small amount of programming that was working on this. We did have some of it in Uganda when I was there, looking at the impacts of long-term conflict on mental health, as there was post-conflict issues in northern Uganda, with the Lord's Resistance Army. Um, but it was very small programming, and it wasn't as robust as it needs to be. So I will say that I think this was a big gap, not just from USAID, but from NGOs and others working, in the trauma healing, on trauma healing programming. There needs to be more of it, and there needs to be expanded focus on that.
Uh, Thank you for that. So, going back to sort of healthcare and medicine, which is one of our is a major focus of our organization. Can you tell us or talk to like how healthcare and medicine is impacted by these conflicts and these regions that are in conflict? How does that play out?
Yeah, I hate to bring up Kenya, but I will because it's another great example of violence, causing people to lose access to healthcare. Hospitals and local clinics were closed, for a time during their election violence phase. Community health workers are really often the ones that are most trusted in a community.
Mm.
They're the ones that know the community best, and they're the ones that go to people's house and provide these home services and home visits. And often during conflict, they're unable to travel and make those home visits, which are so vital for people's care. But in times of violence and conflict, it's really impossible. So it's impossible for health workers to do their jobs. So during Kenya, it was the inability to travel from one location to another,
Mhm.
and really that ethnic divide and people from one ethnic group not being able to go into other areas. So because of that, hospitals, clinics, and community health workers were unable to provide care for a while. In Myanmar, now you see every day that there's hospitals being bombed by the regime. Hospitals are really seen as a target, um, often saying because they're either used as a place for hiding for the opposition,
Oh.
and then so they end up being bombed. Um, and people not having access to this because the roads are inaccessible and not safe for travel. And they don't feel safe going to hospitals because they're worried that they'll be targets. And then just basic transport of supplies. Hospitals in Myanmar lack basic supplies. Their staff are unable to provide even basic care. Um, Unfortunately, healthcare is one of the services that's most impacted by violence. And that's at a time when people need it the most. Doctors and surgeons are putting their lives on the line and working in very unsafe conditions with little to no medical supplies in order to provide the support. They're real heroes in situations like this. Um, yeah, so it makes it even more difficult, and is one of the most impacted parts of people's services that they should be receiving.
Monica, last year we had a conference in Jordan, in Amman, Jordan, and we had a doctor who zoomed in from Gaza, and this fellow was frustrated, right? And and he was agitated. And one of the things that like I don't think that I could have appreciated before hearing from this doctor who zoomed in from the territory was he talked about like he had been there for like 3 days at the clinic, and he's got a wife and children back at home too, right? And so he's like I don't have the equipment, I don't have everything I need. He castigated us a little bit for drinking expensive tea and eating hotel food, but which I like once again, man, like that's I was like I just felt for this fellow so bad. But it's like I have a family and I don't know what their status is, right? I haven't been home for 3 days because I'm here at the clinic, and it was such a reminder, Monica, of the sort of the humanity of it, right? You don't like sometimes we don't think of these people as anything but a doctor or a physician or somebody or a nurse or but really they have the same issues that you and I have, and they're just as concerned, and so I got just this new appreciation for the service this fellow was, providing. It was, like, it just really impacted me. I can't tell you that what it
Mm.
meant. Um, I wanna I wanna change gears a little bit and maybe speak to now okay, so USAID is now it doesn't exist anymore, right? And we understand that many of those services, clearly not all, but, um, some, many, I don't know, are going to be rolled underneath, the Department of State Department. And, can you it's probably too early for us to, like, tell what's gonna happen there, but, like, in your estimation, do you who's gonna carry that torch, right? And do you think that we how much of that institutional memory are we gonna lose? How much of the network that we've built and invested in are we going to lose? What do you see as sort of how this might be carried on, this USAID or foreign aid rather?
Yeah, so I mean, USAID worked in almost 100 countries around the world for the last 60 years. We were the world's premier development institution, looked up to by other countries' development institutions as the leader. When we jumped into issues, when we took on problems, other donors followed because they knew that we would have the systems in place to provide the oversight and report on results. We had assessment tools, the methodology for project design and implementation that other donors and other development institutions didn't have. And so, it is a real loss, not just to no longer have USAID, but that these other donors and other development institutions are not going to have us to lead the way and kind of drive these efforts the way we were in the past. To the answer to your question, I don't know who will be able to replicate USAID's work. I do know that what is moving over to the foreign assistance part of State Department is just a very small fraction
Mm.
of our projects that we were working on. Very, very small. And the institutional knowledge, the systems, the way we went about doing things, that is not transferred over because it's just that takes much more people than they have working on foreign aid and much more of a robust assistance mechanism than they're planning to have. Um, International development is in a phase of transition. And unfortunately, it's really unclear if or when the United States will be able to have this influence in this space again.
Um, that makes me a little bit sad. I'm not gonna lie. Um, Especially when I consider, like, how, like, I'm so inspired by your work, Monica, and in the fellow that introduced us, his name is Richard Nelson. Is such a good fellow, right?
Mhm.
And because I'm here in Washington D.C., I know a few other USAID uh alum, and just so good and so capable. Um, can you, Monica? So GHRI, Global Health and Relief Initiative, we are not for profit, and
Mhm.
and healthcare, medicine, in areas of conflict is sort of our focus. Can you? What advice would you give to an organization like us, or to a an erstwhile NGO that is eager to serve these areas? What advice would you give?
I would advise to find local partners to work with and utilize their networks and their expertise. Some of the most impactful work that USA did was with local NGOs who knew the landscape. They already had relationships with key local actors. They have the most invested in their country, and they understand the changing environments. Local NGOs that were based in the country with local staff, they know what's possible and they can help keep the project on track, but they also know what's not possible and they can help you avoid pitfalls or unsafe situations. Um, they're not going to have the systems and processes that you would see in an international NGO, and some of these international actors. But local NGOs, you can work with them to help build their capacity. And they definitely have a much better understanding about what's possible and what's not. So I think listening to them while helping to build their capacity to do this work, helping them institutionalize systems is extremely important. And USA did a lot of that work, and I think we've really see the fruit of that now as we look across the world. There are a lot of local organizations that are stronger and have the systems, the financial systems, the business systems, the HR systems in place to receive funding from international donors. And I think that's the best route to go is making sure that we try to keep it local as much as possible.
So good. One of the things that we learned too is, like, we're dealing with this crisis that of course, medical crisis, but they had um this outpouring from head trauma specialists, right? And what they need pediatric health specialists is what they need the most, right? The children. And so, it's you can only learn these things with lear from the locals, right? From boots on the ground, and from the people that really know. So I think that is such good advice. Monica, it is such a pleasure to speak with you, and I feel like we can really just kind of go over so many of these stories, and I appreciate the work that you have done, and I know that yes, it's a career, but also from on the outside looking in, Monica, it feels like it's a calling. So I want to thank you for your excellent work. It's been inspiring to hear you. I know that you love the people that you served, so thank you for that. And Monica, may I just make sure that we have your contact? There's like an email address like near this while we post this. So if people want to contact you about your work or about any questions that they saw, may I do that?
Absolutely.
All right. Well, Monica, it is a pleasure to have you on this War and Recovery podcast. Thank you very much.
Thank you.